afternoon. This is Monica Paudel. Today I'm going to discuss about Unit 9 journal assignment. During this week clinical rotation, I had the opportunity to observe and participate in the care of the patient diagnosed with borderline personality disorder, which was particularly impactful experience for me. The patient presented with the intense emotional instability, fear of abandonment, and pattern of unstable interpersonal relationship. What stood out the most was a rapid shift in the patient's mood and perception of others during the interaction. This was my first closely observing how borderline personality disorder manifests in real time beyond a textbook description, and it gives me a deeper appreciation of the complexity of this disorder. This experience significantly enhanced my understanding of the role of psychiatric mental health nurse practitioners, particularly in maintaining the structure, consistency, and therapeutic boundary. I observed how important it is to remain calm, non-reactive, and empathetic even when the patient expresses strong emotion or frustration. It is also reinforced by my understanding of the underlying psychopathology of borderline personality disorder, including emotional dysregulation and maladaptive coping mechanism. I recognize that effective management often require a combination of psychotherapy such as dialectical behavior therapy and careful limited use of medication targeting the specific symptoms. Reflecting on my personal strength, I found that I was able to remain attentive and empathetic during the interaction, which helped to deepen the therapeutic relationship. However, I also become aware of a limitation in my initial internal reflection to the patient's intense emotional expression, as I feel slightly overwhelmed and unsure of how to respond in the moment. This highlights the need for me to continue developing emotional resilience and confidence in managing complex personality disorder. I realize that my response must remain grounded and consistent to avoid unintentionally reinforcing maladaptive behaviors. For this experience, I gained important insight into the therapeutic use of self, especially the importance of self-awareness, emotional regulation, and maintaining professional boundary. I learned that my presence and reaction can significantly influence the provider-patient relationship, particularly with the patient who are highly sensitive to interpersonal dynamics. Moving forward, I plan to apply this learning by practicing more structured communication, strengthening my knowledge of dialectical behavior therapy informed approach, and continuing to reflect on my emotional response during the patient interaction. This will help me to provide more effective, compassionate, and consistent care in my future psychiatric nurse practitioner practice. This was one of the wonderful experience I have and very insightful. I will look forward to practice that in my future practice as well. Thank you.